My name is Dylan Mendoza. I'm here to give an informative speech. Have you ever gone to the hospital to deliver your baby or for the delivery of your child? Well, I did. You imagine to be one of the best experiences in your life. You go to the delivery room, your wife is there, your baby comes out, and you hear the miraculous cry. You're happy, your wife's okay, your baby's okay. In my case, I went outside, went to the area where they put the babies in, then they sent me to the other side of that big window, and shortly thereafter, a nurse came out. And that nurse came out and gave me some news that are not very good news. She told me that my child had a very low glucose level, which is sugar, and that he needed to be put in an intensive care unit, the level 3, which is the highest they have, and that they will give me updates on it. One of the reasons they said, or they asked me, was if my wife was diabetic. And I said that during her pregnancy, she was mentioned something to that effect. One of the things I want to talk about is diabetes. As you may or may not know, there's 3 types of diabetes. There's type 1, diabetes, type 2, and then gestational diabetes, which is what my wife had, and it was during her pregnancy. Type 1 diabetes is more found on children. Children is not rare in adults, of course, but you could get it anywhere from your childhood all the way to the age of 40 or around the age of 40. What happens is that your pancreas does not produce any insulin. It just ceases to produce insulin, which that insulin uses to control the sugar in our bodies. What happens then is that you probably have to use a pump of some sort, carry with you, and inject yourself with insulin. You can live with it, you can live a normal life on it, but that's just, the rare of the two, of the types of diabetes, I'm sorry. And so type 1, found in youths, it uses a pump, and your body does not produce any insulin. Type 2 diabetes is the most common. It affects more or less 90% of the people that have diabetes, and type 1 only affects around 10. Type 2 diabetes is more your pancreas is producing insulin, it's just not doing the right work. Sometimes your body tries to adjust to it and it starts producing a lot more insulin than what it needs, and it just kind of throws your body off balance. That's why we see patients that have diabetic episodes. So those people do not produce the right amount of insulin, and ultimately the pancreas stops working, it stops producing insulin, and then people have to resort to injecting insulin to their bodies. That is for type 2. It's found in all ages. Those people could also adjust their lifestyle. They could have exercise regularly, diet, and inject insulin, and they could control their glucose level. The type that my wife had was gestational diabetes. During her pregnancy, during a certain week of her pregnancy, she's given this test, and what there is, they give her a lot of sugar, and then they check an hour after that to see how her glucose level is, how her body was able to break down that excessive sugar that she drank. Well, it showed that she was borderline diabetic, but it was still considered gestational diabetes. So she had to watch what she eat. Of course, as a pregnant woman, you can't really exercise a lot, but you could, stay active and stuff like that. And as she was borderline, she just needed to caution what she ate and stuff like that. Well, because of her diet or because of just the way things are, proper care, maybe, something happened, but that's the reason that my baby had to go to the emergency room. He was there for about 2 weeks, and luckily he's fine, he's healthy. My wife is not diabetic, and the baby's not diabetic. But I wanted to share this with you because I want you to be aware of some of the things that you might look for in case you want to check if you're diabetic. If you feel thirsty all the time, if you feel that you're hungry or excessive hungriness, even if you're eating, those are signs of for a diabetic. Also, if If you go urinate a lot, that's also another sign of diabetes. Now, the American Diabetes Association has a test. You could go online and you could, they'll ask you some questions, you could take the test, and you could check to see if you have indications of being a diabetic or not. Diabetes was the 7th leading cause in 2010, and it took about 69,000 deaths in the US alone. So those are facts about diabetes and how it affects us. In our profession, we have seen patients with diabetic problems, and we do have a very big concern for them. So if you want more information, please visit the American Diabetes Association website so you can get more information and stay safe. If you have family members that you might want to help out, that is a good source for you to get the information. Thank you.